Hello, good evening, everybody. This is Dr. Alok Sharma. It's 9 o'clock, and we would like to start the webinar right now. We are ready, but I've just been told that we need to do this webinar where what we are going to do is look at the recent advances in the treatment of autism, cerebral palsy, and certain other incurable neurological disorders. I'd like to thank the organizers of this webinar for arranging this, and I'm sure this is going to be informative for you. So, I'm Dr. Alok Sharma. I'm a neurosurgeon, and I specialize in a new form of treatment that is referred to as stem cell therapy, which I do at the NeuroGen Brain and Spine Institute, which is in Navi Mumbai, India. I'm also professor and head of department at the Medical College, LTM Medical College in Mumbai. Uh, Before I begin, I'd like to state that this presentation is for information purposes only. It's not a substitute for a medical consultation for which you should consult your local doctor. And we gratefully acknowledge Autism We Care and the parents who have invited us to make this presentation. So, why are we here? We are here because we all have children who have special needs. I believe that there can be nothing so deeply emotional than having our children suffer from any medical ailment, no matter what. We can take anything on ourselves. But when our children have any medical problem, it takes away everything from our life. But when our children have a neurological problem, a brain problem, and especially one for which the whole world says there is no cure, it makes matters even worse. And the question we ask ourselves, well, science and technology is developing so much, and we are sending people to Mars, and we are, doing all kinds of, you keep hearing of all kinds of scientific breakthroughs. Why can't my child be helped? That's a fundamental question in your mind. And I'm here to tell you that, you know, finally your prayers have been answered, and modern science and technology has come with a solution that can help our special need children. So I'm here to shift you from a state of hopelessness to one of hope. Now, we are going to talk about three different treatment modalities that we do together. And these three together make a difference in our children's lives. These three treatments together have the ability to reverse autism. Yes, you heard me correctly. It is possible to reverse autism. And I want that to sink in. What you've been told, that you have to live with your child having autism, is no more true. So, what is this combination? This combination is one of cell therapy that we refer to as stem cells, rehabilitation that you're all familiar with, and a new set of treatments called integrative therapies, which are primarily oxygen based therapies that increase brain oxygenation. So, this combination of cell therapy, rehab, and integrative therapies together will help our children recover from the problems they are currently facing. So, the old thinking was that once the central nervous system is damaged, it is incapable of regeneration. There's nothing you can do about it. But the new thinking is that some amount of regeneration is possible through a process of cellular replacement and repair. So that is what the new thinking is, that some regeneration is possible. So I just put this slide to show you. On the left hand side, you can see this is a X-ray of the leg, and you can see the bone that is broken here. This is a fractured bone of the leg. And I ask you, if we were to have a fracture of the leg, would we do physiotherapy or rehabilitation on a broken leg? We would not, right? We would take this to an orthopedic surgeon who would, like is shown on the right side, put plates and screws, fix the fracture, and now we would do rehabilitation on a fixed and repaired bone. But when it comes to our children with neurological problems, we do the exact opposite. This is a scan that shows you, the blue area here is the area that's damaged. Above is normal, and you can see there's damaged brain. And all our children with autism and cerebral palsy have brains which are partially not working like this. And what we do is we do rehabilitation on this damaged brain. Now, what if we could repair this damage? As you can see, here there is no green, and you can see, green has come back. Here you can see no green, and you can see return of green. What if we could repair this damage and now do rehabilitation on that? Wouldn't it be much better? And that's what I'm here to show you. The result, the reason why, despite all the rehabilitation, our children are not improving is primarily because we are doing rehabilitation on a damaged brain. If we do the same rehabilitation on a repaired brain, we will get much better results. So I told you I'm going to talk to you about three things: stem cells, rehab, and integrative therapy. So let's look at stem cells first. So what exactly are stem cells? The word stem comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, fruits, flowers, etc., there are some cells which can give rise to any cell of the body. And these cells are called stem cells. So did you understand? From a stem of a plant, you get a branch, you get a leaf, flower, and fruit. That's why it's called stem, because everything starts from there. And there are some cells from which you can get any cell of the body. These cells are called stem cells. So stem cells are of two types. You can get stem cells from our own bodies, that means from our children's bodies, and put them back into our children. That's called autologous. That's what we use and what we do. Or you can take the cells from somebody else and put them in your child. That is called allogenic. We do not do allogenic. So how do stem cells work? Basically, they have the ability to multiply. So if you have a single stem cell, you can make thousands of stem cells from it. Second, they convert into other cell types. So if you have a single stem cell, you can make it into a nerve cell, or you can make the same thing into a heart cell or a muscle cell. In other words, you can make a stem cell whatever cell you want. That's the amazing property. You have a cell with which you can do anything. And this is a picture from our own research. This is what a stem cell looks like. And when we grew it in the laboratory, we first showed that the stem cell can convert into nerve cells. These are nerve cells, as you can see, and they are connecting to each other. So we showed that the stem cell can change and become a nerve cell. Stem cells also release certain positive chemicals in the brain, and these positive chemicals, called growth factors, result in a lot of brain improvement. They also improve the blood supply to the brain. So earlier there was less blood supply, and after this you have an increased blood supply. So this combination, the ability to multiply, the ability to convert into any cell type, and in our case we convert them into brain cells, the release of positive chemicals and improved blood together repairs damaged tissue, and together has the potential to improve the brains of children with autism. So there are different types of stem cells. You can get stem cells from the embryo, that is the unborn fetus. So life starts a father's egg and a father's sperm and a mother's egg comes together. And when it becomes one, that one becomes two, two becomes four. And on the fourth or fifth day of life, it forms a bundle of grape-like cells called blastocyst. From this bundle of grape-like cells, the entire body is formed, which means that these cells have the ability to form any cell of the body, because from this, the brain will be formed, bones will be formed, heart will be formed. So if we were to remove this and grow it in the laboratory, we could make it into whatever we wanted. But embryonic stem cells have certain ethical issues about their use. They're also medically dangerous. So we do not use embryonic stem cells. I repeat, we do not use embryonic stem cells. You can also get stem cells from the umbilical cord. And the umbilical cord is the cord that connects the mother and baby at birth. And nowadays at birth, this is being preserved. And if it has been preserved, it could potentially be used, but we are not using this either. What we use is something called adult stem cells. What are adult stem cells? They occur in children also, although they are called adult stem cells. These are stem cells in our own bodies. So all of us, all of you listening, as well as all your children, and as well as me, we have stem cells in our body in different places. One place where there are a lot of stem cells is the bone. And this has got millions of stem cells inside because in the center of the bone is a liquid called bone marrow. And this bone marrow has got millions of stem cells. So if you put a needle into the bone and take out the bone marrow, we can get millions of stem cells and then we can convert them into whatever we want. So we use adult stem cells, and whatever I talk later after this is adult stem cells. I repeat, we do not use embryonic umbilical cord. We use adult stem cells, autologous stem cells from the child's own body, put it back into the body. And the last type of stem cell is induced pluripotent stem cell. This is a combination where the outside is adult, inside is embryonic. But this is in the research stage still, and it has not been applied to, it's not being used clinically so far. So we decided to work with adult stem cells because they are safe, they never form tumors, they never get rejected. You can easily get them with a single needle prick, and there are absolutely no ethical issues about the use of adult stem cells. Now, the way to inject stem cells back, you can either inject it intrathecal, that means in the lower back, we can put a needle in and inject it into the spinal fluid that goes to the brain. So this is called intrathecal. This is what we do. You can also inject it intravenous, intramuscular. Intravenous is like an injection which you get in your veins. You can put it in the muscles. You can put it through the nose, directly in the brain. There are different ways of putting stem cells. So uh, but we prefer the intrathecal one. So stem cell therapy is also referred to as regenerative medicine. Uses healthy cells to replace damaged cells. In a single sentence, what is stem cell therapy? You take good, healthy cells and use them to replace bad, damaged cells. That's called stem cell therapy. So here's a picture. You can see this is the brain damage in a child with autism. You give stem cells and the damage goes away. What's the scientific base for stem cell therapy? So you're all aware that the highest recognition in medicine is the Nobel Prize. And three times in over a 15-year period, 1990 to 2012, stem cell therapy has got the Nobel Prize. It is not often that one field, see, the Nobel Prize is for all fields of medicine. And yet a single field, stem cell therapy, gets the Nobel Prize three times. In 1990, when they demonstrated bone marrow stem cells in the bone marrow, which is what we do. 2007, the isolation of embryonic stem cells. And 2012, mature and specialized Professor Gordon and Yamanaka got it for showing how mature and specialized cells can be reprogrammed into iPSCs. So three times the Nobel Prize. And what is the scientific basis of the work that we do? We have got a total of 101 scientific papers which we have published. So what is the importance of this? See, when we do our work, how do you know whether our work, what the results we are talking about, whether they're authentic, genuine or not? The only way to know is if our work is published in indexed medical journals. Because before publishing our results, these journals verify our results, they authenticate them, they validate the scientific and ethical content. So we don't have one or two, we have over 100 scientific papers, 16 on autism, 15 on cerebral palsy. So all our work is published and the results are peer reviewed, because when something is published in a journal, the journal and three independent people, they verify that data. Also in medical textbooks, so this is published by SMG Group, Recent Advances in Autism. This is a book. And in that book, they introduced a chapter, Stem Cell Therapy, and they asked us to write the chapter. In this book on cerebral palsy, it's published by a European publisher, Intech, they introduced a chapter, Stem Cell Therapy for Cerebral Palsy, and they asked us to write the chapter. Similarly, in this book on physical disabilities, they introduced a chapter, Stem Cell Therapy in Pediatric Neurological Disabilities, and they asked us to write the chapter. In this book on muscular dystrophy by Avid Science, they introduced a chapter, Stem Cell Therapy as a therapeutic modality for muscular dystrophy. Again, they asked us to write the chapter. So as you can see, medical textbooks, so I showed you 100 journals, but medical textbooks have started introducing chapters on stem cell therapy, and most of the time when they write it, they invite us to write those chapters. In India, the government at the highest level is very supportive of stem cells. Our Prime Minister, Honorable Shri Narendra Modi, when he went to Japan, he visited the laboratory of Professor Yamanaka. It's very rare that somebody at the level of Prime Minister would take the trouble to go to a stem cell lab, but he actually did that. In India, also, whenever he gets an opportunity, he will visit stem cell facilities. I was very fortunate that in one of the books that I have written, the introduction of the book was written by Sri Narendra Modi. It's not often that you have somebody at his level writing an introduction for a medical book, and yet one of my books, and that is me presenting that book to the Honorable Prime Minister, and that is the introduction that he wrote. You can see that's his signature, and this is the introduction. Just to show you what stem cells means to him, there is a small talk of Prime Minister Narendra Modi in Parliament, where in a very impassioned speech, he speaks very strongly about stem cells. मैं जापान में तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामा को मिलने गया मैं इसलिए किया गया तो उन्होंने स्टेम सेल के अंदर जो रिसर्च की है मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी खोज हमारे काम आ सकती है हम गए तो वहां गए उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट था आज इस दिशा में हमारा काम हो रहा है कि स्टेम सेल के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें. So there we heard the Prime Minister of India talking in Parliament about stem cells. You know, it's not often that medical topics are discussed in Parliament, but here you heard that. So after giving you a little background, how is this treatment done? So that's the beauty of the treatment. It's a very, very simple treatment. So what we do is we take a needle and we put it into the pelvic bone, which is the bone just above the hip bone. This is a real picture, and I'll show you a video of this. We put it into the hip bone, and we take out the liquid in the bone called bone marrow. This takes about 15 to 20 minutes. Once we've taken out the bone marrow, we take the bone marrow to our laboratory where we filter it and separate the stem cells from the other cells. And once we have stem cells with a very thin needle, we inject it into the lower back. Why in the lower back? Because there's a fluid in the lower back called cerebral spinal fluid, which takes it up to the brain. So the whole treatment, there are only two needle pricks. With one needle, we take out bone marrow. With the other needle, we put it back, the stem cells, into the spine fluid. There's no surgery, there's no operation, there's no cutting, there's no stitching. Just two needle pricks. Now let's see a short video of how this is done. So I'll run that video again. So here you can see this is the bone marrow coming out. You can see the bone marrow, and then we take it to the laboratory where we separate all the stem cells, and then with a very thin needle, we inject it into the lower spine. So once again, because it's important for you to understand what happens, this is the bone marrow aspiration, this is the separation in the laboratory, and this is how we inject it into the lower back. Two needle pricks only, no cutting, no stitching, and no surgery. So now let us very briefly look at what exactly is autism, because I understand the feedback I've gotten is the majority of people attending this webinar are parents of children with autism. So we are going to spend a little time understanding what exactly autism is. So autism is a neurodevelopmental disorder. It was first described in 1943. So it's a recently described thing as compared to other illnesses. It occurs is diagnosed in the first 3 years and be classified either as mild, moderate, or severe. and boys have it 4 times more than girls. Now, if you see the incidence of autism, it has gone through the roof. In 2004, 1 in 166 children had autism. By 2018, it was 1 in 59, and by 2021, it's touching. I understand somewhere 1 in the 40s, 1 in 40 or something. So there is a dramatic increase, an unprecedented increase. Never in the history of mankind has any children's disease increased so rapidly, where from a time where it was almost non-existent, now it is so highly prevalent. This means that there are about 70 million people on the planet who are on the autism spectrum, which means 1% of the world's population. Our population is 7 billion. If 70 million people have autism, that's 1% of the world's population. So that's not a small number. It's 1%. One out of every 100 people have autism. The main problems in autism are poor social interaction, problem with communication, and repetitive behavior. So what is new? Why are we having this webinar? What is different today than some time ago? What is different is today we have a better understanding of autism, and we have a new treatment available called stem cell therapy. That is what is new, and I'm going to talk about both of them. So here's the first part. We have a better understanding. Now, this is a PET CT scan. This is a new scan of the brain. It's a functional study. It actually shows you which parts of the brain are not working properly. Now, this blue is that part of the brain that's not functioning properly. If you do an MRI, you don't see this because MRI shows you structure, whereas a PET scan shows you function. So even if this brain is there, it's not working properly. It's not working as much as normal. So we have done these scans in more than 3,000 patients, and we have found every child of autism has this. Children with cerebral palsy have something else, a slightly different problem. Children with intellectual disability have a different problem, but all of them have this kind of hypometabolism in the brain. Now, so this work of ours is published in a prestigious journal, the World Journal of Nuclear Medicine. You can see this is our paper, where we actually published what exactly is wrong in the brains of children with autism. Which parts of the brains aren't working properly? So our study also showed us that you see, this is age and this is SUV or brain metabolism. The higher it is, the better it is. So normal children between the age of 3 to 5 to 10 to 15, the SUV keeps on increasing, keeps on increasing. But in children with special needs, it keeps on decreasing. Now, why is this important? This is important because finally, what do we want? We want our children's brains to also be as close to normal as is possible, right? That's what we want. So if we start correcting here, I have to bridge only this gap. But if I correct here, I have to bridge this gap. This gap is much bigger than this gap. So the earlier we start the treatment, the better it is. Now, why is this important? Because a lot of parents say when it comes to stem cell therapy, let's wait, let's watch, let's see how the treatment evolves. Please understand that the longer you wait, this is what is going to be happening to your child's brain. You're going to be going down this ladder, which means if you could correct it here, correcting it here is going to be a little more of a challenge. So it's always better to treat earlier. Now, in the management of autism has been multidisciplinary, and there is a whole lot of treatments that go together, and we look at some of these together. So the second part of my talk will talk about neuro rehabilitation. This I will go through fast because you're already familiar with this. So we have applied behavioral analysis, ABA, which says that every behavior has something that precedes it and there's a consequence. And by changing what precedes it or the consequence, you can change behavior. This is done by psychologists. We have occupational therapy, which has different components from activities of daily living to cognitive behavior, recreation, vocational activities, etc. We have sensory integration therapies, which basically used for children who have primarily sensory problems. It's a part of occupational therapy. And this is what a sensory integration room looks like. This is the SI room in our hospital. Then there is speech therapy that all of you are familiar with. Then there is physiotherapy. Now, earlier it was thought that children with autism do not have any physical problems, so they don't need physiotherapy. But we have found that's not true. These children do have motor coordination issues, clumsiness, tone abnormalities, gait, postural, and joint issues, and so they all need physiotherapy as well. Aquatic therapy is again very, very useful. It helps so many things like sensory issues and cognitive functions and sleep patterns. So one of the most important things is the sleep pattern change. So aquatic therapy is therapy in water. It's not swimming. It's therapy in water and requires very specialized therapists to do this. Then there are art-based therapies such as music therapy, dance therapy, etc. Then there is chelation, there is PRS detox. Then there is supplements, which I'm sure you all have given to your children, vitamin B6, vitamin C, omega, DMG, inulin, etc. Then there is diet, and there are some things that are to be avoided, like sugars, additive pesticides, and there's some foods to eat, like probiotics, prebiotics, a ketogenic casein-free diet, vitamin-rich food, camel milk is supposed to be good, curcumin, etc. So this is something which a professional dietitian will advise you what to do, what not to do. Then there's something called a ketogenic diet. This is a diet which is just enough in proteins, but high on fat and low on carbohydrates. But despite this, are we doing enough? And the answer is no, and that is why we need to add stem cell therapy. So this is our results with 700 patients. We have now treated almost 2,000, but these are results from 700, which showed us that 90% of our children showed improvements. 33% had a significant improvement. That means they got back to a near to normal life. 29% had a moderate improvement, 25% had mild, and 10% did not improve. So what we found here was something very interesting, and please listen to this carefully. We found that all the kids who had a significant improvement, they were all under 11 years. In fact, they were all pre-puberty. You're all aware what is puberty, right? I mean, the mustache will come, the voice will change, sexual organs start growing. So those boys treated before puberty did much, much better, and they went on to lead almost normal lives. 29% of the our cases had a moderate problem, that means a moderate improvement, 25 mild, and 10% did not improve. So we found that all those who did not improve were over 20, and the mild and moderate improvements were between 10 and 20, and 33% were all below 11. So the if you notice what I'm saying, the younger the child, the greater the chance of improvement. The older the child, the less is the improvement. When the child is very old, improvements are negligible. So on what basis can I say that stem cell therapy works for autism? I can only say it if there's statistical significance of our results and if I can show objective improvements on brain imaging. So here are the statistics. We took all our children treated with stem cell therapy. We took a median score before the stem cell and a median score after the stem cell. Median means you take all the patients, take all their scores and divide it by the number of patients, and then you get a score. So this is before stem cell therapy, and this is after. And then you do a mathematical calculation, and we have to show that it is significant, which it was for us, the CGI score or the ISO score as well. And this is just to show you the statistical significance in everything, in social relationship, emotional response, speech, in all the things, there was a significant, statistically significant change. And this is one of the most important slides of my talk. Above is a child with autism. This is a horizontal section, vertical section, lateral section. And you can see the blue brain damage in all these. This is the same thing, you're seeing it from 3 different views. This is before stem cells, and below is 6 months after stem cells. You can see the amazing improvement. You can see all this blue, it's gone. Look at this blue, it's gone. So you can actually see a significant improvement in these children. Here again, you can see the damage before, and you can see the damage is gone. Here again, you can see the damage before, and you can see that the damage is gone. So this is objective proof that the damage in children with autism can be reversed. And I'm showing you 2 or 3, but I have over 3,000 such scans. of children before and after, 3,000, showing improvements after stem cell therapy. So some people question. They said you are showing improvements at 6 months. How do you know these improvements continue? So for a few patients, parents who are willing, we did it year after year. So you can see June 2012, you can see the damage much reduced in 2013, 2014. It's almost completely gone. So the improvement is progressive, right? So our work is published in a very prestigious journal, Stem Cell International, and this is the world's first international PubMed index paper on stem cell therapy in autism. It has been written by us. This is our paper. The second paper came from China. The third paper came from Italy, and the fourth and fifth paper came from America. So we published the world's first scientific paper on stem cell therapy in autism, and that's a genuine matter of pride for me. Not that I published it, but that it came from India. That's what makes it feel good. And we have several other publications, total of 16 papers on stem cell therapy in autism. And now we have a couple of videos. We are going to show you some, 2 or 3 videos of kids. And so I've got videos of one child from each continent, one from North America, one from Europe, one from Asia, one from Africa, and one from Australia. But we'll just see 2 of these. So this is the first one is this child from America who had a severe challenges in terms of speech, in terms of behavior. He was in a special school before. His father is a cardiologist, a doctor in America. Mother was a nurse before. And let us see their story very briefly.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just flew backward.
He would flap like that, and he would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He never looked you straight in the eye. He had problems with his speech. And research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. I said, we have to do
He started seeing better eye contact, definitely different from his engagement with us, with his siblings, his mood. He was so much calmer now. He's all about taking his own shower. I have to just prompt him to get out. But he'll wash himself and he'll put his clothes on. All the PET scan images. We were just so excited and thrilled. The areas that were hyperactive or non-active were new ones. There was activity there. Dinesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level.
So those were the amazing improvements in Ganesh. From a special school, he's gone to a normal school, and he's topping his class right now. Now, as parents, you all know how difficult it is to manage a single child with autism. And the next video is of a mother who had triplets, and all 3 triplets had autism. Can you imagine what a life it must be to manage 3 kids with autism? Let's see the story.
As we went to different hospitals, and when I got it up, they were like, oh, no, don't worry, because they're boys, they're triplets, they are premature. I'll be walking out and I'm like, bye. No child is crying, no child is leaving back. And by then, for sure, I knew that they should be. Children had this behavior of disappearing. In fact, Eric disappeared a few times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we need to understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in the pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
I think that would have taken probably years to be accomplished in my son. In like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of sleeping. The type ones that were used, sleeping used to be a problem before, but at the moment, you take it to his bed, takes a few minutes, and you sleep.
You see my son fight. We try to make them understand what it is to have the kind of business. But after stem cell, when we arrived in Kenya the following day, when we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah,
Okay. So I'm going to give you
money.
for what?
Buy tomato money. Wow. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So the first movie was this child from America. The second movie are triplets from Africa, Kenya. And we'll just see one more, this child from India, who's done remarkably well. Let's see his story.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child had a problem, it shocked me and I wondered why did this happen only to me.
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade.
So he passed from school and he's
There have been improvements in many other aspects as well. For example, his emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
So, did you notice that last part? A child who could not talk before stem cell therapy, after stem cell therapy, not only has he got back normal speech, but now he teaches deaf children. Yes, he takes tuitions for deaf children. So that is the possibility of probability of what can happen with stem cells. There are a couple of other videos, but I'll skip that. I'll go straight to very briefly. We'll look at a couple of other conditions. I was told there may be some children, parents of children with cerebral palsy. The principles are generally the same, so I'll just rush through all of these. In cerebral palsy, there is brain damage, but the effects are seen in the body. In autism, the effects are seen in the mind, in speech, in behavior. But in cerebral palsy, you can see it in the body. So that is because there is injury at the time of birth. And there are different types of cerebral palsy depending on which part which part of the brain is injured. It could be one half of the body or just the legs, or all four hands and legs, dystonic, acidoid, ataxic. There are different descriptions of CP. And this is a PET CT scan, and you can see, as if you remember the brain of children with autism, the damage was much less. In CP, the damage is significantly more as compared to autism. There are some medical treatments available. There are some anticonvulsants if they have seizures, some drugs for spasticity, etc. There are some surgeries we can do. We can cut the nerves to reduce the tightness. We can do some orthopedic procedures to help in movement. But none of this corrects the fundamental problem in the brain. Our own results with stem cell therapy for over 600 patients. We have now treated more than 2,000, but this is data of 600. 20% show a significant improvement. That means they are close to normal. 41% have a moderate improvement, 30% are mild, and 9% don't improve. But unlike autism, here there is no age correlation. In autism, I told you the younger people improved the maximum and then it went down. Here, there is no age correlation. But you still have 91% of the kids overall improving. And these are the symptoms that improve. Their oromotor, they have drooling of saliva which stops, their balance improves, their upper limb and lower limb movements improve, the tone of the muscle gets better, they're able to ambulate and do activities of daily living much better. And here's a scan. Here's a scan before. You can see this damage. This blue is the damaged part, and you can see post-stem cells. It is significantly reduced. Now here again, you can see pre-stem cells, the blue damage, and you can see post-stem cells is gone. Damage is completely gone. And this is our paper. Of course, unlike autism, this is not the first. Somebody had published before us. Autism was the first paper. Cerebral palsy is not, but still the work is published. Clinical study of autologous bone marrow cells for cerebral palsy, what we call a new frontier. And we have several more papers on the same subject. And here's a video of a child from Kenya again, and he was completely wheelchair bound. He could not even sit properly. He could barely, use his hands very little, and he could not stand. Now let us see his improvements. There you can see before totally wheelchair bound. Now he can wear a t-shirt now. He's able to pack his bags, his fine motor. See, this child could not even get off the wheelchair first. Standing was impossible. Now, not only can he stand, he open the fridge, take out a bottle of water, open it and drink himself. Now look at that. A child who was totally wheelchair bound is now able to walk without any support. He's walking by himself. He's able to use his hands. This is completely life altering, completely changes the life, not just of the child, but of the parents as well. So that's the miracle of stem cells. Then just a couple of other conditions. There's something called muscular dystrophy, where the muscles get weak, and you can see gradually at 5 years, Graves' normal muscle, and over the years, the muscle disappears. At 16 years, there's almost no muscle. Here you can see at 5 years, Graves' good muscle. At 21 years, nothing. The muscle is gone. And by 25, all these kids who have Duchenne muscular dystrophy, they all die. And these are our results with over 1,500 patients. 4.5% had a significant improvement, 35 moderate, 20 mild, 14 remained stable. That means they did not deteriorate, but they didn't improve either. But you have to remember that if we had not treated given stem cells, all these would have deteriorated. So even stable is an improvement, but we had mild, moderate, and significant as well. So this is the life in Duchenne muscular dystrophy. This is life-saving. If you do not treat them, 100% of the kids die. 100%. Every child of Duchenne muscular dystrophy dies by 25, and we've been able to save their lives, and they're living much beyond that now. And this is a comparative study. You can see the graph in green is children who took stem cells, and you can see that their condition stabilized. And we compared it to those who did not take stem cells, and this is how they would deteriorate. So there's a big difference between untreated patients and treated patients with stem cells. Big difference, and this saves their lives. And here's the evidence. You can see the white, this is white here before stem cell, there is no black, no muscle, and after stem cell, you can see this has become black. So there is muscle recovery. And this is an EMG, which is very weak before treatment, and after stem cell, you can see it is much, much increased. And we are waiting scientific papers on stem cells and muscular dystrophy. And here's a child from America, California, who was not able to stand at all and now stood for 2 years before he came to us. Could barely sit, could just crawl a little, and let us see improvements after stem cells. You can see before he is hardly able to crawl, and after you can see that he's standing. The first time he stood in 2 years. First time he stood on his legs. He never stood for 2 years before. Now he can not only is standing, he's going to walk a little steps, but still, it's better than being on a wheelchair. And now you can see he's walking, without that help, just holding a parallel bar. He reduced his dependency. Which is amazing. Now you can see he's walking all by himself indoors. Nobody's helping him. And here he's walking all by himself outdoors. And he improved so much that even he got an invitation from the White House, and President Obama met him to speak to him about a story. That's him with President Obama. So, just to share his improvements. Then there is intellectual disability, which is different from autism and cerebral palsy. It's a little milder, and you can see this is the kind of brain damage. The light blue is the brain damage and intellectual disability. These are results. We have an 84% success rate, which 20% significant improvement, 25 moderate, 35, 39 mild, and 13% do not improve. And what improves is their memory, problem solving, relationships, social inhibition, and toilet training. And here's a scan. You can see the damage before in the blue, and after stem cells, the damage is gone. So this is the improvement before and after. You can actually see the objective improvement. And again, our paper is published, and this is again the first of its kind in the world, the world's first paper on stem cell therapy in intellectual disability. This has been written by us, uh, and we have three other papers on this. Then spinal cord injury, people who have an accident, their spine gets fractured, and this is data from over 1,000 patients with 24. Now, these are people who are totally paralyzed; they cannot move the legs at all. And 24 had a significant improvement. 56 had moderate, and 15% had a mild improvement. That's a 96% success rate. And their tightness improves, their sensations of urine improve, their trunk control improves, and there's a lot of other improvements. And this is our work is published in a scientific paper in the Journal of Neurorestoratology, where it's the original study showing the clinical effects of stem cells in spinal cord injury. And we have 9 other papers along with that. So a short story of a captain from the Indian Army who was shot by terrorists in Kashmir. He was totally paralyzed when he came to us. He could barely sit, not stand at all. And we treated him with stem cells, and let's see his improvement. So you can see afterwards, you can see he's sitting properly, which he could not. He's able to get up from below onto the bed. He can get up onto his wheelchair. He can transfer into a car. There you're seeing he's transferring into a car himself. And this is from a point where he could not even sit by himself. Now you can see he's walking. There he is. He's walking, and this is an old video, it's 2 years old, but now he can walk much better without that. He was given one of the highest awards for bravery, the Shaurya Chakra, by the President of India. He also won a bronze medal in the shooting championship, the national. And most important, he joined back active duty in the Indian Army. It's very rare that the Indian Army takes back people who are paralyzed because of bullet injuries, but he improved so much that he could join the army back. Brain stroke, this happens either because of a blood clot in the brain or an infarct in the brain, and one side is paralyzed, one half of the body. So here you can see our results are really good. 51% of the patients had significant improvement, 3% only did not improve. And here's a scan. Above you can see the blue, that's the damage, and you can see lower down, most of it is gone. You can see this whole blue damage here, and you can see after treatment, it's all gone. So it helps in recovery, brain stroke. We have 6 papers on this. Then in head injury, we have road traffic accidents and people go into a coma. And we've had good improvements in that as well. 29% had a significant improvement. Only 5% did not improve. And this is a scan to show you. This is a scan before, and this is a scan after. And you can see that the damage is gone. And this is again, our paper is published in a very prestigious journal, Springer Plus, Cell Therapy for Traumatic Brain Injury. And here are a couple of other papers. So here was this patient. He was almost in a you can see he's almost in a vegetative state before. You could not talk to him. He didn't understand who you are. Did not recognize. There was no communication. Afterwards, you can see on the right side. Afterwards, he started responding. Now he had been like this for 3 years before he came to us. Suddenly, after stem cells, he started responding. He started sitting by himself. He became cooperative, and he improved a lot. So you can see he's sitting by himself, and there you can see the right side is not working at all. You can see he's moving his right side. And most important for today's time, he's able to eat by himself, which he could not do before. His mother had to feed him. And now he's able to read, he's able to use a mobile phone. Now he was totally vegetative. He was sort of in a almost comatose state. And from there to the fact that he can actually use a mobile phone. So that is the improvement that can happen. In the last medical condition, motor neuron disease, this is a fatal neurological condition. 90% people die within 5 years. And this is our graphic. We did a comparative study Patients treated with stem cells, they stabilize like this, and patients untreated, they all deteriorated. So here again, it helps them save their lives, and papers published in a very prestigious journal, American Journal of Stem Cells. We have several other papers on this. So one question coming in your mind would be, well, I'm talking all good stuff about stem cells. How safe is it? Are there any complications? So here's the good news. There are no major complications. We've never had a major complication at an adverse event or something where the patient deteriorated or became bad. We've never had that. No patient has had a neurological deterioration. There are some minor adverse events. For example, in kids who have a history of epilepsy, who have known epilepsy, 3% of these kids they may develop epilepsy after the therapy, but only in those kids who already have epilepsy, and in 3% only. 10% of the patients may get headache or vomiting. It's called a spinal headache for 1 or 2 days after the treatment. There may be a little nausea, vomiting, etc. So overall, there are no major complications. There could be a few minor complications, but they are small, infrequent, and they are manageable. Now, the last part. So I spoke to you about stem cells. I spoke to you about rehab. And now I'm going to talk to you about integrative therapy. So what are integrative therapies? So integrative therapy is a combination of using medical technology to be able to infuse oxygen deep into the brain, cause healing, modulate the immune system, and reduce inflammation and swelling. So the most important of this is hyperbaric oxygen. So basically, there is a chamber. You go inside, as you can see, it's a glass chamber. It's visible to you. The parent with the child will go inside. There's a television on there. They can watch their cartoons, etc. And then we just shut the door, and we give oxygen under pressure. Now, what is the advantage of that? The oxygen under pressure, normally at normal pressure, oxygen can only be carried through our red blood cells, the hemoglobin and the red blood cells. When you give it under pressure, it goes to the liquid of the brain, and the entire liquid of the brain is now carrying oxygen. So it goes into little nooks and corners. So hyperbaric oxygen is like an amazing tool, and we are finding that when we combine hyperbaric with stem cells, we get even better results. So then we have ozone therapy. So ozone is so oxygen is O2 and ozone is O3, and it's a very powerful tool which helps to supply oxygen, at greater concentrations of tissues. It kills all infections. It modulates the immune system. And has a very, very overall beneficial effect. So we have hyperbaric ozone. Then we have so these are different ways in which we can give ozone. Then there is gut cleansing. We have colon hydrotherapy, where in older children, we can't do this. In younger children, we can cleanse the gut. There's a lot of gut issues with our children. So we can help with that as well. And then there are various other therapies like whole body cryotherapy, IV vitamins, etc. So this is the institute where we work, the NeuroGen Brain and Spine Institute. This institute is set up for this purpose, set up for one purpose only, to help children and adults with neurological problems recover, survive, and heal. We've treated more than 10,000 patients from 70 different countries. Yes, more than 10,000 patients from 70 different countries. So we have the largest experience in the world. And people from all over the world, from all the 6 continents, have come to us for therapy. So this is our core team. I'd like to acknowledge all of them. Dr. Nandini and Dr. Prerna, they are our stem cell experts. Dr. Jacob is India's senior most physiotherapist and rehabilitation expert. And Dr. Imangi Sane has an amazing story. She was a physician in America. She did an MD from America, was working in New York when she developed the disease we discussed, motor neuron disease. All the doctors in America told her she had only a few more months to live. She went to the best doctors, John Hopkins and everywhere else, and everybody told her, sorry, nothing can be done. From America, she came to India. She approached me. I treated her 10 years ago. In America, they had given her only a few months. It's 10 years, and not only is she not deteriorating, she's improved, and she now heads. She wanted to work with us because she wanted to do research, and now she works with us, and she's doing well. 10 years after diagnosis, when 90% of the people die within 5 years. So she's a real inspiration to us. We believe a lot in quality control. So we have various certifications like good laboratory practice, good manufacturing practice, and higher certifications. We are also certified by the European Medical Association, the EMA, for best medical practices. And we've written a total of 16 books. We've received several prestigious awards like the Rose of Paracelsus Award from the Socrates Nomination Committee of Oxford. And this is a very prestigious award that's given for pioneering research. We were given uh, a European Award for Best Practices by the European Society for Quality Research. Again, this award is given for the highest standards of research. We were named the best stem cell therapy center in India in 2016 at the National Healthcare Excellence Awards. Again, in 2018, the Health Minister of India, Minister of State for Health, gave us the award for the best institute of stem cells in India. Uh, Now, to help you make your decision, we have a website. It's called NeuroGen BSI. BSI stands for Brain and Spine Institute.com. You could email us. We have a response time of less than 30 minutes. So if you email us, you'll get an instant reply. We can WhatsApp chat, we can audio video call, you could call our mobile number that's listed below, or you could do a Skype interview with prior appointment through our website. Once you've decided, we appoint a coordinator who becomes your one point of contact for everything. We assist you through the whole process till you arrive here. During the stay, what happens? You arrive on a Sunday. On Monday, all the evaluations happen. Tuesday is the stem cell therapy. Wednesday to Saturday is rehabilitation. Saturday, there is discharge. So it's a Sunday to Saturday program only. You can't come in the middle of the week. You have to come on a Sunday only. How safe and easy it is to travel to India for stem cells during the difficult times. So we, recently had a mother who came to us from Zambia. We just recorded what she had to say about her travel.
My full name is Lauren of the Banda. I am Banda because I'm married. I am from Zambia. Zambia is a country in Africa, Central Africa. That's where I'm from. I came on the 27th of November from Lusaka, Zambia, via the Islam, Tanzania, to Mumbai, which is in India. I brought my son to the NeuroGen Institute, Brain and Spine Institute in Manhattan, from Zambia to India. I traveled safely. All that is required to get safe for a person around this time of the COVID related travel is to have the COVID certificates, which I did. We managed to get them on time to travel. So traveling from Zambia to Dar es Salaam was alright. They did not ask a lot of issues other than the exemption certificate from the NeuroGen Center. That's the very most important document. That one has got to have in order to have, otherwise they don't know anyone to claim. So once they saw that one, from Lusaka, Zambia, they asked the same whether in Mumbai when I arrived for the same document. The NeuroGen team have been very, very excellent in as far as using documentation is concerned. They are efficient, they produce the information right on time. They never delayed in my preparation. I have been on time. The NeuroGen Institute, the European Center, is very, very accommodating. Staff in my country, they are just giving visa for medical travel. It doesn't matter where you're going, but it has to be a medical visa. That medical visa is issued to the person who is serving who is sick, as well as the attendant or attendants. Also, the airports are not congested as before. The airports are just okay, but still, there are a lot of people available.
So my conclusion is that adult stem cell therapy, which we do, is a safe and effective. Notice I've said safe before effective. treatment option for autism, cerebral palsy, and many other pediatric and adult neurological conditions. So we heard the Prime Minister of India talk about stem cells, and the world's two biggest democracies are India and America. So let's hear the President of America talk about stem cells.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with that, I'd like to thank you all for participating in this webinar, and I am now open to. It was supposed to be 1 hour. I think I've stuck to my time. I've overshot by 8 minutes, so that's okay. And so now we are open to questions, and or any of you who have questions, please you can ask your questions on the. So I'll be answering some of the questions. Nilima Sharma says we did twice 6 months gap. That time was 3 years old. We've seen improvements. So you have seen improvements. That's good. But there are still many problems now. She's 7, and we are now planning for a third shot. That's fine. So you're most welcome. So the rule is like this: if the damage is mild, you need a single treatment. If it is moderate, you need 2 treatments, and if it's severe, you have to be treated 3 times. Then anonymous attendee says, can there be any chance of not getting improvements after SCT even if the child is less than 6 years? What are the factors prevent SCT to not work? So age is the major factor. The other factor is if we don't do rehabilitation, because the results of stem cells come from rehabilitation. And so it's like if the brain is a computer's got hardware and software. So the stem cell corrects the hardware. The software is put by therapies. It's that combination that works. So it's very, very important to follow our advice regarding what type of rehab to do. And if you don't do that rehab, we may not see the results you want. But otherwise, we've almost never had any child less than 10 who is not improved. They all improve. An anonymous attendee says, my child is unable to gain weight and is diagnosed with autism. Does SCT help address this issue as well? So we've seen 2 extremes. We've seen kids who put on a lot of weight, and we've seen kids who are unable to put on weight. Right? So we've seen both these extremes, and surprisingly, both these things do get corrected with stem cells. We find that there is a rebalancing of weight. So yes, the answer to your question is that it will help. Krish K asks, what are the areas in general where we have significant improvements for kids around 6 to 8 years on ASD in general? Have you seen any case helped by communication area where kids who are not verbal prior treatment? Krish, so the most important improvements that we see is their understanding, their cognition, their response to commands. Then we find that there are changes most important in their concentration, in their attention, then their hyperactivity is significantly reduced. And then there are, of course, speech improvements also. Now, everybody doesn't have the same speech improvements. We've had anywhere from a minimum of 20% speech improvement to a maximum of 80%, or even, sometimes a little more. So we have some kids who are now, not all, okay, some kids who can speak to the sense, to the level that you can't make out they ever had a problem. And then you have others who can speak partially. And there are others where they've just, from no speech, they've just picked up a few words and can say a few things. So there's a very wide spectrum of improvements, but they all improve, whether they improve a little or medium or more, but they all improve. Then Chris asked, location of treatment is currently available in Mumbai, Ahmedabad, and India. So right now, we are, of course, in Navi Mumbai, and this treatment is available right now in Navi Mumbai. To the best of my knowledge, it's not uh, available. This combination treatment is not available in Ahmedabad. Uh, Again, there are different stem cell therapy centers, but at NeuroGen, where I work, what is special is that we do only neurological cases. We only do, people who have a problem with their brain or spinal cord. All the other centers, they do everything, cancer, heart, cosmetic, like everything. So we focus on neurological. Two, we have a very extensive rehab program, which very few facilities have. And third, we are now combining this with integrative therapy, which is hyperbaric oxygen, ozone, etc. So this combination of stem cells, rehab, and deep oxygen therapy, this is not available anywhere else. Krish again asked that we have both cord blood and cord tissue saved from the time of birth. Does it make any difference in the treatment? So this cord tissue and the cord blood which is preserved, see it is preserved, so it has got preservatives. And one of the preservative is DMSO, and this preservative is harmful to the brain. So we cannot inject this into the spinal fluid, like what I told you. This can only be given intravenously. But when you give it intravenously, 90% or 70% of it actually deposits in the lungs, another 20% in the liver. So a very small amount reaches the brain. Also, the total number of cells preserved is much less than that what we need. So I would suggest you keep those cells. God forbid if it is needed for something else in future. But right now, taking the child's bone marrow and using those cells is the best. So Shrika Nagpal, it's really required to do genetic testing so that we can find out proper cause of ASD, ADHD. We also did genetic testing for my 2-year and 9-month-old daughter and found some genetic reason for ASD. Yeah, so firstly, all kids on ASD are not because of a genetic problem. So we cannot say that autism is a genetic disease like Duchenne muscular dystrophy. It's a genetic disease, right? Autism is not. Now they are discovering that there are some genes that may be abnormally functioning, but irrespective of them, it does not change our treatment. Now, if we could do genetic testing, and that's available with us too. If you want, we can do it when you come here. But we believe it's not required. It's very expensive, and all it does is give us some facts. They don't help in the treatment. They don't help with the child. So we can do the genetic testing. We can keep a report with us. But we believe it is expense for academic reasons which really don't help the child. Also, it doesn't change our treatment. Our treatment is going to be the same, whether there is no gene problem, whether it's few gene problem, or whether it's lots of gene problem. It doesn't change our treatment. So, well, if you want to, yeah, we can find out the cause, but I don't think it's required. And then anonymous attendee says, can diabetes be addressed using SCT in adults? Well, there are some people doing it, but we don't do it. We are focused on neurological problems, so we are not treating diabetes. At present, it would be indicated only in uncontrolled diabetes, a very advanced stage, like if with all medication, insulin is not coming under control, then we could consider it, but we don't do it. Does SCT address the issues with PANS, PANDAS? We hear that some parents get worse after SCT. Please confirm. So our the therapy that we do is primarily going to fix the damage in the brain. I showed you that PET scan, I showed you what damage there was. And what our therapy will do will repair the damage. Now, once it does that, all the other issues, all of them, okay, automatically start getting sorted out. Or even if they don't get sorted, they are not causing a problem. So if our child's behavior gets normalized, if our child's speech comes back, if our child is able to read and write and go to a normal school, and then it really doesn't matter what the other issues were. The other issues become important when we are not treating the fundamental problem. Once we address the fundamental problem, what else exists or coexists becomes seriously irrelevant. Now, you said that some parents become worse after SCD. So we've noticed a couple of the only times where children have become worse is if they've had a very high fever, not normal cold cough fever, like very high, 102, 103. Then high fever for some reason causes deterioration. So we have to be careful that our children don't get any chest infection. Uh, but apart from that, by and large, children don't get worse. If we do proper rehab, if we take all the care, then there's no reason for the child to get worse. But yes, fever can cause deterioration in the child. Ajinkya Rilekar says, sir, when stem cells are injected in the spine, how do they get converted to brain cells? Is there a possibility that those stem cells get converted into other types of cells? So, what we do is, and so just to let you know that uh, I I'd gone to America to learn how to culture embryonic stem cells, fetal cells in 1998. From 1998 to 2008, we just did work in the laboratory. We grew all types of cells, embryonic cells, umbilical cord cells, bone marrow cells. We first, in the laboratory, confirmed that they get converted into brain cells. And in my lecture, I showed you a picture from my research. I showed you a stem cell. I showed you how they got, and that was from my original research, it's not from the internet. In the laboratory, we first proved that they convert into brain cells. How they convert into brain cells? Stem cells convert depending on the environment they are in. So if you take the same stem cell and put it in the heart, they become heart cells. You put it in the liver, they become liver cells. When you put it into the brain through the spinal fluid, they become brain cells. Stem cells become where they are kept. So when we inject it into the CSF, there is no possibility to become something else. So if you put it in the heart, it cannot become a brain cell. It will become a heart cell only. If you put it in the kidney, it will become a kidney cell only. So how they get converted, that's a very complicated technical explanation. I have it, I've researched it, I've done it and proven it myself. But it's the very nature of stem cells that wherever you put them, they convert into that. And there is no possibility that they will get converted into any other cell type because nature is managing. That's the beauty of our treatment. We are letting the body do make the internal changes with the stem cells to become what they want. We're not artificially doing it. The body is doing it to itself. Then another anonymous attendee says, can the stem cells survive in higher oxygen levels when we leverage? Yes, they can. So there's no question with that. We've actually done a lot of work on this. And we found that there is no problem. In fact, we are seeing wonderful overall clinical results. When we have combined stem cells with hyperbaric and ozone therapy, the results which we are early seeing in 6 months, we are now seeing at 2 months. So there's a faster improvement when we combine this. Yeah. Then Deepak Soni says, is there any side effect of stem cell therapy for autistic child of 3 years? So I had answered that in my lecture. No, there are none. If your child has never had epilepsy, then there is no risk whatsoever. But if your child has had epilepsy, then there is a 3% possibility that post-treatment in the first 2 months, the child may have epilepsy. That is the largest side effect that can happen. Nothing worse can happen. This happens in very small, just 3% of the patients. And it's not a very major concern for children who have never had epilepsy. So your child is 3 years old and if he's had no epilepsy, there's no risk whatsoever. I have met so many parents who undergo stem cell therapy but they didn't get any benefit. So I don't know whom you met and where they have taken treatment, but we have all the patients that we've treated who are below 10, right? below 11, actually before puberty, they've all shown good improvement. I myself showed you in my graphic, 10% of our patients don't improve. 10%. So if we do 100 patients, 90 will improve and 10 will not. So there will be a certain percentage of patients who don't improve. Now, what we found is those are kids who are of a little older age. So you may have met some patients from that 10% group. And if you saw my data which I presented, I never said we have a 100% success rate. We showed you a 10% patients who did not improve. So if you happen to have met some of them, uh, well, maybe they have told you they have not improved. Also, it depends on multiple things. It depends on how much therapy is done. Now, if you do stem cells and don't do therapy later, you may not have such a good improvement. Also, for example, if the child develops fever later, then the improvements can sometimes, you can have improvements and then they could go back. But our personal experience is if you do it below 10 years, you can expect good results. You know? And Marush, oh, it's a very long name, Mirinda, where Marush Kalaroon Anika, it's a very, very long name, I can't read that name. But Mirinda, so where can we do the stem cell therapy in India? So in India, you could do it at the NeuroGen Brain and Spine Institute, NeuroGen, NeuroGen, that's where I do my work. And it's a dedicated neurological institute for stem cells. It is located in Navi Mumbai, which is a satellite city of Mumbai city. So basically, you'll have to arrive in Mumbai, and once you're in Mumbai, then it's a very short drive from there. Stem cells is available at the NeuroGen Brain and Spine Institute in Navi Mumbai, India. My son is 2.6 years. Can we go for a city? Yes, of course, you can go for a city. So age is no barrier. The body weight is the child should be more than 10 kilograms. So if the weight is less than 10 kilograms, we can't do it. Any child more than 10 kilograms, age is not relevant. We can do the stem cells. How stem cells works in genetic disorders? So stem cells don't work to correct the genetic disorder. Stem cells work to repair the damage caused by the genetic disorder. See, they're two separate things. There's a genetic disorder which has caused some damage. Now, we are not fixing the genetic disorder. That's not possible to fix. What we are doing is we are fixing the damage it has caused, the damage in the brain, the damage in the muscles. And by repairing the damage, we are giving quality of life improvements. How does stem cell therapy help with gut dysbiosis and the microbiome leaky gut syndrome? So here's something very interesting question you asked. See, earlier we believed that the gut problem, the leaky gut, was the cause of autism. I mean, we thought it was the gut that was causing autism. Then, over the last 12 years that we've been doing stem cells, we noticed something interesting. A lot of children who came to us with severe gut issues, okay, various kinds, I mean, all kinds of gut symptoms. Then we had a separate group of kids who used to eat, used to eat mud, they used to eat toothpaste, salt, they used to eat their own poo. I had one kid who used to eat glass. Can you imagine? He would break, glass and just eat it. All these kids, all of them, and I say all of them without exception, when we did the stem cell therapy, this eating of, mud and chalk and their own poo just disappeared. And then when we looked into it, we realized that what happened was it was the damaged brain, because of which the gut movements were slow. And because the gut movements were slow, the excretion was longer. So, if when we eat food, our food gets digested, it passes through the small and large intestine and is excreted in a certain time. In kids with autism, because the brain was damaged, the gut movements were slow, it took a much longer time. And because it took a longer time, there was, there were various GI issues. So what we found, and we were surprised, that correcting the brain damage, so like earlier, what was our thinking? Correct the gut and the brain will improve, and maybe it does, but it does, nobody's ever cured autism by improving the gut. But when you treat the brain problem, the gut issue is resolved. So that's the amazing thing about repairing the brain with stem cells. Um, does then Anil Kumar asks again, does it start speech in a non-verbal autistic adults? What's your experience in speech center of the brain being activated? So yes, it does. I showed you the video of Ganesh who can talk normally now. He had very little speech. I showed you a video, of Shantanu who had no speech, and he's improved to the point that today he passed his 10th standard. He's studying in college. He's working. He's making a living, and he's become a tuition teacher for the deaf. So yes, that the speech areas do get reactivated, but it takes time. Speech is the last thing to recover. So, it can take up to a year or even more for speech to come. We've had some kids where the speeches come after 2 or 3 years, but it does come back, right? So speech does come, but it is the last thing to improve. And we've had several kids who have had phenomenal improvements in speech. Uh, Anonymous attending pricing for the first and second treatment. So this is a medical lecture, and as part of a medical protocol, we normally don't discuss any pricing or commercial things. I suggest for any pricing, please email the hospital directly. This talk is for information purposes, so I will not be able to share any pricing. Pre-advising plan to expand cells. So no, we used to do a lot of cell expansion before, and then we found that see, try to understand. The moment you expand the cells, you have to add chemicals to it. You have to grow them, you have to add preservatives, you have to do various things, and that takes away from the naturalness. So we are in a different context actually using expanded cells, but for autism and CP, we don't use expanded cells. We believe that when you put the stem cells in the CSF, that nature itself, the body itself expands them and differentiates them. So we let the body do it. Instead of doing it in the laboratory, we let the body do it inside. So Gunjan Shani, she during the treatment we would need certain amount of staff to help because just one parent would be accompanying the child. So would we get some help at NeuroGen? Yes, of course. Once you come to NeuroGen, see when you come to NeuroGen, it's not a hospital; it's like home, and every need of yours will be taken care of. You will have attendance, and you will have help, and you'll have everybody. We will all be there for you. The entire staff is completely geared up and trained to deal with special needs kids. We understand their hyperactivity, their aggression. We know how to handle it gently. So we are so the staff right from the entrance, from the person at the security gate to the senior most doctors and the therapists in between and the nurses, we all will look after the child. So you don't worry about that, Gunjan. Anil Kumar says, what about inflammatory issues caused by the leaky gut? So that's what I'm saying. Uh, what we are finding, and of course, I don't have definite proof of this, but from because we've treated over 3,000 kids and we've treated over 10,000 patients in all, about another 2,500 of cerebral palsy. From our experience, you fix the damage in the brain and the gut issues resolve themselves. That's our observation, that all the gut problems disappear. And is HBOT a part of the first treatment or it depends on a case to case basis? So HBOT is a part of the treatment. However, we cannot use it in kids who have a history of epilepsy or who have any severe problem with the ear because it can cause certain issues. So for all the children who are otherwise medically fit, hyperbaric oxygen is an intrinsic part of the treatment. In those who it cannot be given, we use ozone therapy only. Um, Vinay Yaga says, is this a one-time treatment or it requires multiple times? So I mentioned this earlier. When you come to us, we will do the PET scan of the brain. In the PET scan of the brain, like I showed you, we are going to show you those blue areas which are the inactive areas, weaker areas, non-functioning areas, damaged areas. Now, if the damage is mild, it will need only one treatment. If the damage is moderate, it will need two treatments. If the damage is severe, it will need three treatments. So that is the type of improvement. So mild single treatment, moderate two treatments, severe three treatments. Uh, Now, Sarmista Mukherjee says, Dr. Sharma, I think that's my daughter Shrestha. I thank you. I think you remember. Yes, I do remember Shrestha's case. I want to know, so it is said 98% cells on the body. So, how longer and what criteria her development will be visible, sir? So, Sharmista, you're going to see, it takes, once we put the cells in, and what we told you, 90, the report we sent, is a percentage of viable cells. So anything over 95 is good. For your 98 was excellent. Now it takes between 3 to 6 months for these cells to convert into brain cells and form connections and see improvement. So somewhere between 3 to 6 months, you will see good improvements. Yeah. Krish wants to know the treatment costs for the first, second, and third setting. So, like I mentioned, in a medical talk, I don't discuss costing. So, for that, you'll have to email the hospital directly. Uh, Somebody asked, can you advise why NeuroGen is better than Panama or Cancun? So, well, we are all colleagues. We work together. So normally, I'm not critical of anybody else. But I'll tell you what is different about us. First, NeuroGen treats only neurological patients, only neurological. We don't treat cancers or liver, heart, kidney problems. So at Panama and Cancun, they treat everything. If you have a hair fall, they treat you. You've got cosmetic problems, liver, kidney, heart. We do only neuro. That's number one. Number two, we have a very extensive rehab program. It's very comprehensive. It's got occupational therapy, speech therapy, behavioral therapy, art therapy, aquatic therapy, special education, counseling. So there's a whole lot of therapies that are integrated rehabilitation, which we not only do for the child, but we train the mother how to do it at home so you can continue it at home. We video record all the therapy and give it to you on a pen drive so that when you go back, you have something to assist you. Um, so this rehabilitation, a very extensive rehab program, this is not available at Cancun or Panama. The third thing is we have an integrative therapy. So along with our stem cells, we have hyperbaric oxygen, we have ozone, we have a gut cleansing protocol. So there are multiple things that we do in addition to the stem cells. Again, out of the best of my knowledge, this is not available in Panama. So this is about what we do. Secondly, we have treated over 10,000 neurological patients already over the last 10 years. I don't think either of these centers can match our figures of neurological patients. But most important, we have 101 scientific published papers, 101. And these centers, I don't even know if they have any, or if they have, it's just a handful. So at least in PubMed index journals, there is no paper from either Panama or Cancun, whereas we have the world's first paper. The second was from China, third from Italy, and fourth and fifth from America, and then there are others. So all our work has been peer reviewed. Journals, their independent evaluators have evaluated us and published all our papers, which means our data has been judged by somebody else and it is before publication. So that is what is the difference, that their work is not published, our work is published. And of course, I mean, I could go on and on. I could go endlessly, but that's the difference between us and Panama and Cancun. At what age Ganesh, who had a success story presented, was Krish asked. So he was about, I think, between 6 and 7 when he was treated, and he's done very well now. Anil Kumar says, are we to assume that the brain address fixes the gut following the early answer, and that has not been our experience? So this is what we have seen. I'm not saying the gut problem gets fixed. What we are seeing is the effects, that the gut issues that the parents notice, they seem to get resolved. So have we gone inside with the endoscope and studied the gut? No, we haven't. But what we have seen is a simple thing. You have a kid who just picks up mud and eats, or we had a kid who used to take an entire packet of salt and just eat it. So entire packet. We had one kid who used to just eat spice, entire packet of red chili, just swallow it. You do stem cells and it stops. We had kids who used to have a habit of eating hairs, and like I said, glass, and it completely stops. Um, Also, we have now included, so of course, we've seen improvements. But one of the things that we have now included is ozone therapy, which we give for the gut as well. So we give it per rectum, and that helps in resolving some of the issues in the large gut. And that's an addition to a program which is more recent, which is over the last year or so. But it's a belief, and I don't have the evidence for it, that you fix the brain problem and the gut issues settle. I've heard from other parents that we need to get some kind of genetic test done before you even consider stem cells. Is that the case? I haven't heard relate to that in the webinar. No, you don't have to get any genetic tests. I repeat again, you do not need to get any genetic tests before you do stem cells. The genetic tests have nothing to do with our stem cell therapy treatment. So whether a genetic tests show that there is some gene issue or there's no gene issue, it doesn't change the treatment. We are fixing the brain problem. And because we're fixing the brain problem, the genetic issue really doesn't concern us. So there is no need to do that. How many cells are we going to get for a 5-year-old with 36 LBS? I can't make it. That's pounds. Maybe. So yeah, so the number of cells depends on the body weight and certain other factors, and so it's a mathematical calculation which is based on multiple factors. But the cells are in millions. They are in several millions. And when you come to us, we give you a report of the exact number of cells that were put into your child, including how many were viable and not, etc. Atul Mahajan asks, will you be recording all therapy advices so that the parents can see when we go back? Yes, we record all the therapy advices and we give the whole thing to you on a pen drive. Next question is, how long do I need to wait for SCT as your centers have done SCT at Panama recently? So if you've done SCT anywhere else, we recommend a minimum of a 3-month gap, just so that whatever effect that is had to happen. So it's a standard advice. If you've done SCT somewhere, wait for at least 3 months, because once you've done something, let that have its action. Now, if after that you see a very good response, then you don't need stem cells anywhere else. But if you're not happy with the response at 3 months, you're most welcome to come to us. But gap of 3 months. Varsha Bijoy says, hello, my daughter is 12 years old. She's a very rare kind of muscular dystrophy, CMD. Thankfully, she can move and cycle, speech, virgin good. Very good vocab, good grasping concepts, but poor ADLS and locomotor skills. Any previous experience in CMD cases? Do we need first PET and then plan? What can we expect? Yes, we have treated the CMD cases, and they do very well. And some of girls tend to overall do better than boys, and I think it's got to do with the hormones. So when you come to us, we will do all the testing and scanning once you come to us. Because we will decide what tests are needed, and we will do only the tests that are needed and required as per our protocols. But I think you should do stem cells because the results in CMD are good. Then Varsha says, also since we know dystrophy has started on the left side, can we inject stem cells in the part? Yes, we do that. So in muscular dystrophy, we inject the stem cells in the muscles that are affected. We'll do an EMG, we'll do an MRI of the muscles, we will do a detailed evaluation. We identify which are the weak muscles, and we, apart from injecting in the spine, we actually inject it into the muscles in muscular dystrophy. Then anonymous attendee says, can this stem cell work for global development delay disorder children who are not diagnosed with autism? Yes, it works beautifully with kids who have a global developmental delay disorder. And because what we are doing is we are correcting the damage in the brain. And once the damage in the brain gets resolved, whether it's causing global developmental disorder, whether it's causing cerebral palsy, whether it's causing autism, whether it's causing ADHD, what we are doing is we are fixing the damage in the brain. And once we fix the damage in the brain, all the symptoms, irrespective of what we label them, they will resolve. So I think with that, all the questions are answered. I'll be happy. And what we have offered at the beginning is that all the people who attended this thing, you can do a one-on-one consultation with me. It's free of cost. We are happy to do a video consult with you. What you have to do is coordinate with Jigyasa, who's been the coordinator of this program, and then we can set up a one-on-one. We have to It has to be set at a preset time before, and then you can ask me specific questions related to your child that sometimes you're not able to ask in a in a webinar like this. So I'd be happy to be with you um, and answer any of your personal questions um, on a one-on-one video WhatsApp call. We find a video WhatsApp call is the best way to communicate because we can see each other. You can ask me whatever questions you want, and I'll be very happy to answer them. With this, I'd like to hand over the presentation to Jigyasa, and you can take over. Yeah? Thank you so much for attending.